Without further ado, I'd like to introduce Sharon.
Hi, so I'm Sharon. I'm going to talk tonight about the core and its role in injury prevention as well as in athletic performance. Just to give you a quick outline of what we're going to go through, we're going to just talk about the function and components of the core first. Then we'll talk about studies that kind of link it to injury and injury prevention, and then just a couple strategies for how to effectively train your core. So first off, what is the core? I asked a lot of my friends when they asked me to do this presentation, and I got your six-pack. I got that donut thing. Someone said, I have no idea what are you talking about. And one person who wasn't a healthcare provider said, from here to here. And that is the closest answer I got. So just to kind of go over it, the core is more than just your six-pack abs. It is composed of passive structures, active structures, and neural structures. So it's not even just the muscles. It's pretty much everything from here to here. Passive structures are going to include bone, cartilage, ligaments, fascia. And then we have your active structures. These are all the muscles. And they can get separated into your local stabilization system, the global stabilization system, and the movement system. Local stabilization system is going to be any of those muscles that attach between spinal segments. They provide stability to the intersegmental parts of the spine, and they're going to prevent excessive compression of your spine. They're going to prevent shear, so the spine moving on itself, and rotation of the spine. They're also full of muscle spindle fibers and other things that are going to help with the neural control system to provide proprioception and postural control. So the muscles of your local stabilization system. Six-pack doesn't even make the list. You have your transverse abdominis. This is kind of your corset muscles. They go around your spine and kind of cinch everything in. Your internal obliques, which are on the side. The multifidus in your back, and if you've ever seen a bodybuilder, sometimes they've got a Christmas tree look on their back. That's the multifidus. The pelvic floor forms the bottom of your core, and then the diaphragm, your breathing muscle, forms the top of it. Then you've got your global stabilization system. These are the muscles that attach from your spine to your pelvis, so we're not just in the spine anymore. They're going to help transfer the load between your upper and lower extremities, and they do this by providing stability between the pelvis and the spine so that force doesn't get lost as it's moving through your torso. They're also really important for providing stabilization and control when you're doing functional movements. These muscles include your quadratus lumborum, or many of you probably heard your QL. It's the muscle that helps you hike your hip up. Your psoas major, that's one of your hip flexors. The external obliques, which are your laugh muscles on the side. When you laugh, you feel those guys contract. Your internal obliques are also part of the global stabilization system. Now we get the six-pack in there. Your glute med in your hip is part of it, and then the adductor complex on the inside of your thighs. And then the movement system is anything that attaches the spine or pelvis to your extremities. They're the ones that actually produce force for you to move. So they're going to be shortening to create movement, and then eccentric deceleration. They're controlling the speed of your movement, making sure that you don't just lose control with the other muscles pulling too hard. These include your latissimus dorsi, your hip flexors, hamstrings, and quadriceps. So those are the muscles, and then you've got your neural control system. These are going to be all the proprioceptive structures in your muscles and joints that send information to the central nervous system. The central nervous system then tells these muscles what to do based on the information that they get. It's going to tell you either to contract your muscles to prepare for a movement. So they're the ones that tell you to contract your abs so you stay upright, so that when you flex your hip, instead of bending over, you stay upright and lift your leg. And then if you're hit, suddenly they're the ones that send a message back to get you to stabilize before you fall over. So the core is working in coordinated activity. Again, the muscles of the core are stiffening first, the muscles of the extremities are creating your motion, and then this stable core allows the motion from the limbs to be transmitted to let you move and work effectively. So when you have coordinated muscle activity, you have a nice lunge that looks like this. Each of the individual spinal segments is stabilized. You have minimal external forces either from your legs or outside working on you because you're going to be stabilized. You have intra-abdominal pressure, and then they're going to reinforce the thoracolumbar fascia, which is a giant piece of fascia on your back, kind of like the IT band in your leg, that actually provides a lot of stability for the core as well. When you have an inefficient core, your lunge looks something like this. It's not very pretty, and your physical therapist probably picked on you for it. Causes of this are that you have poor muscle endurance. You just don't have the endurance to hold a good position. You're not firing properly, so the central nervous system isn't telling the muscles when to contract and how well. Or you have imbalanced muscles. So one is just working better than another. This results in compensatory motions. It's going to increase strain to your passive structures, and then you're more likely to have an injury. So just kind of an example. Most core deficits can lead to ankle sprains. They're linked to patellofemoral pain, IT band syndrome, and chronic low back pain. And the reason is, if you look, most of our activities happen in a closed chain. That means our foot is planted. If you were just sitting here and you wanted to move your foot, you can move your foot independent of your knee when your foot's unloaded. When you put it on your ground, as soon as I try and bend my foot, now my knees and hips have to bend too. So whenever there's a closed chain activity injury, we have to look above and below, and a lot of times the core gets implicated in decreased control leading to that injury. So just some studies to back up that I'm just not making this up. They looked at core stability in college athletes at 6 universities. These were basketball and track players, not track, cross country. They had 140 kids, and what they did was they tested their core at the beginning of the season, and then they followed them for the season to see how many got injured, what the injuries were, and how many days of practice they missed as a result of these injuries. And the measures were hip abduction isometric strength, which is just kind of cool. They literally tied the kids to the tables. So if you think we're mean, at least we never strapped you to a table. I don't think. So what they did was there's a dynamometer, and that measures the force produced. They tied them down so that the leg wouldn't actually move, and just measured how hard they could push against that strap. They did the same thing for hip external rotation in the second picture. And then the modified Bearing Sorensen, they strapped them to a table, had them lift their backs up, and saw how long they could hold a flat position to measure back extensor endurance. And then they did the same thing with a side plank. And then the two that I don't have pictures of, they also did a flexor endurance test. The first one they tried was the leg lowering test, which many of you have probably done. You lie on your back, your legs are straight up at 90 degrees, and you have to lower them down slowly without letting your back arch. So they measured to see when their back arched in the range of motion. They weren't getting great variety in the results with that one, so they switched it to another endurance test where they had them sit at a 60-degree angle, took away their support, and saw how long they could hold that position. What they found. 41 athletes got injured. There were 48 injuries among those athletes, and on average they missed 6.8 days of practice or games. Generally, the injured athletes demonstrated lower core stability measures on all of the measures, but the two that were most significant were their hip abduction and their hip external rotation, so their ability to do this motion and then this motion. Abdominal performance, so that leg lowering or the staying flexed position, was lower in the injured athletes, but not significant. The biggest predictor was hip external rotation strength. And then the side bridge, if you want to quickly screen someone, that one correlated to all other tests. So if they have a weak side bridge, a short side bridge, you can probably guess the other ones are going to be weak.
It's 48 out of how many?
140. So 41 athletes out of 140 of the athletes. The injured athletes, so the key thing from this study was that they had significantly less hip strength, and external rotation was the biggest predictor of not just back pain, but lower extremity injury. And trunk endurance, which has long been correlated with it, so the one where they were able to hold their back up or hold the seated position, was actually less effective of a predictor. And then there was one poor girl who they singled out who had a season-ending injury. She had an ACL injury. And they wanted to point out that not only was she weak on one of the core measures, she was weak on all of them. And she was well below the average for everyone. So they weren't studying ACL injuries in particular, but the fact that she was so much lower on all the core measures makes them think that might have had something to do with the fact that she was the only one who had an ACL injury. But I would not want to be the girl singled out in an article for that. So this next test that study I looked at was looking at trying to correlate whether core measures are associated with ACL injuries. So just to give you guys some info on ACL injuries, most of them are non-contact. It's not that you're getting hit or falling. Most of them are you suddenly change direction with a planted foot, so you're twisting on your knee. For this study, they looked at 14 healthy subjects, and what they had to do was they knelt on a force platform, And first they pushed on them in all 4 directions on their trunk to see how much force they could produce in each direction. Then they applied a 30% of that force to the front, to the side, to the back, and saw what happened when they removed that force. How quickly were they able to regain equilibrium after a force was removed. They also measured peak knee adduction, so the knee going inwards with cutting, and then peak tibial internal rotation, which is the tibia turning, the knee actually rotating with a cutting maneuver. What they found was that there was a significant correlation between their performance on sudden force release and the movement of the knee. So if they were weak when you let go and they had a big movement before they regained equilibrium, they were more likely to have a big adduction moment or tibial rotation moment when they cut. So that's that position that puts the ACL at risk in a cutting maneuver. So this is just that trunk control directly affects the dynamic environment of the knee, and that different muscles are recruited to control the knee motion in side-to-side or rotation. So it's not important to just train one trunk motion. What they found was the sideways one was more important with whether the knee moved sideways, and front resistance was more important on whether you were able to control the rotational moment. So you can't just train one motion to protect your lower extremities. This one, just to prove that it's not all about the back and the lower extremities when we have injuries, they looked at core stability and pitchers. So they had 347 pitchers in the developmental, the minor, and the major leagues for this study. And what they did was they measured pelvic tilt when they lifted their foot up. So they put like an inclinometer or a level on their back, had them lift their foot 10 centimeters, and saw how much their hip went backwards when they did that. When you lift your foot, you should be able to do it without your hips moving. You should be able to stay perfectly still, and if you've worked with me, you know that because I hounded you for it. So what they found was the group with the high tilt, that meant their pelvis moved more than 8 degrees when they lifted their leg, was missed 99 days of practice that season on average. Pitchers who fell into the moderate tilt missed 46 days. That was 4 degrees to 8 degrees of motion. And then the low tilt, less than 4 degrees, was 44 days. So if you were in that moderate or low tilt group, you were doing okay. But that high tilt group really had problems. And these weren't back and lower extremity injuries. These were shoulder and elbow injuries. Only a handful of them hurt their backs. So not being able to control their hips led to more force being applied to their shoulders and elbows to make an effective pitch, and more injuries. The high tilt group was 3 times more likely to miss 30 days due to an injury than the low tilt group. And then to look at how core training can help prevent injury. One study looked at 433 firefighters. So these are guys with a pretty intense job. They're crawling, they're pulling, they're pushing, lifting. They had them do 21 3-hour seminars, and what they did during these seminars was teach them the principles of functional movement, how to move effectively and protect their bodies, techniques for strengthening the core and to decrease mechanical load. So if you have to bend over to work with a victim, putting your hand out so that you're supporting yourself and not relying on your core muscles as much. How to analyze the work site and use principles of functional movement to protect themselves. And then at the end of every session, they taught them core exercises and went through this program. They looked at how many injuries the same group of firefighters had before they got injured, before the intervention and after. So assumption is if you were someone likely to get injured before, without intervention, you should still be someone likely to get injured. After they went through this training to improve awareness of core mechanics and improve strength, lost time injuries decreased by 62%, and total injuries, so injuries that didn't prevent them from working, decreased 44%. The most significant reductions, again, were in back injuries and upper extremities. And then they also changed in lower extremities, but these weren't a significant difference. So just to summarize, if you have core deficits, it's going to decrease your lumbopelvic stability prior to moving your limbs. This is going to lead to compensatory movements in either your trunk or your limbs, so that really messy lunge or squat that I showed you. This is harmful and inefficient, and then you get injured and you're sad. But then you get to hang out with us. Oh, we all win. So now to talk about how to get a better core. There are 4 components to strength and ability. There's power, there's strength, there's endurance, and there's neuromuscular control. The 2 that are important for the core are endurance and neuromuscular control. Power is less efficient because power is force times velocity. Your spine is a pretty easily injured thing, so you don't really want a lot of power there. You don't want to be lifting high volume at very fast velocity. You're going to put a lot of unnecessary strain on your back. So it's not really what you're going to train in your core. Strength actually turns out isn't that important. You only require about 5% of your max strength in your core to perform daily activities, and only about 10% for athletic activities. So as long as you have a certain level, you're okay. The big things are endurance, so being able to do it for a long time, like the whole day, and neuromuscular control, which is being able to turn it on and off really fast in response to those perturbations or sudden movements. So when you're thinking about core training, things to think about is remember that the core works mostly to prevent motion by stiffening the torso. It's not a motion creator. Okay? It allows the power generated in your hips or your upper extremities to be transmitted through the core for pushing, for pulling, for lifting, for carrying. And when the spine bends, this is actually an energy leak that compromises your power. If you think about it, every time you push a car in the snow, you stiffen up your back, you get your arms in nice and close, and you push really hard through your legs. You're not bending your back to do it. If you've ever tried to push a piece of rope that's not coiled and you just kind of push the end, it's just going to bend up. You're not going to actually get the rope anywhere. So that's an energy leak if you're bending things. So sit-ups. How many people have done them? How many people have had a physical therapist tell them it's a good idea to do a sit-up? Ever wonder why? I guarantee not one of us has told you to do a sit-up. Don't do them. Crunches, okay? Remember, the core functions to resist motion, not create it. How often do you go through life doing this? Is that a really useful motion? Okay? The sit-up puts unnecessary stress on the spine. The spine doesn't really like being bent that much, and you're just going to do it repetitively. It also compresses the lumbar discs, and it actually shortens your muscles to do a bent knee sit-up. So when this guy is trying to stay still in this position, he's got to contract his hip flexors, he's got to contract his glutes, he's got to contract his hamstrings in order to stabilize against his trunk moving. Now you've got short hip flexors, short hamstrings, you're not going to be walking so well. Core training is actually a lot easier than you think. It doesn't really require any special equipment. Anything that requires co-contraction of those muscles in the lumbopelvic region is a good core activity. You can do it doing body weights, free weights, or doing balance exercises. Those are all going to get your core going. Easiest way at the gym to get your core involved in your workout is to do free weights. In this machine, he's doing a biceps curl. Anyone ever use this machine? How many muscles are working? Just your biceps. You are completely stabilized. You don't have to stabilize yourself. Do it standing. Now your whole body's working so that only your arm is moving. So now you're working your core. But please don't do it like Arnold, because all he's doing is working his back here. Which I did go to gym, the guy's just going like this all the time. It's not getting his biceps either or his core. I don't really get an injury. And then you can progress core stability. So the first thing you need to do is learn where your core is and just contract it. Squeeze the muscles, laugh, breathe out through your straw. These are all things that are going to help you find your core muscles. And then you need to learn to maintain that contraction and dissociate your arms and legs from your trunk. When you move your legs, your hips shouldn't move. There's a joint. Initially, you'll start on your back, on your stomach, and on all fours. And then you can progress these to sitting and standing exercises. And then add movements in when you're sitting and standing. Do a straight plane movement, so just forwards and backwards. And then make a star pattern with your foot, keeping good positions. This is a really fun one for those of you who like physio balls. You do a plank on the ball, and then you stir the pot without falling off. Good luck trying that. So just some examples of exercises. On your back, there's a lower abdominal progression. Keep your back still, put your hands on your hips, make sure they're not moving, and just march. Okay? If your hips are staying still and your legs are moving, you're working your core. You can also do heel slides, bent knee fall-ups, and bridging is a great exercise for most people. Then once you've mastered it on your back, start doing quadrupeds, starting in planks, starting in standing, add in your arms and leg movements. Again, as long as you're keeping your torso still, you're working your core. Great exercises to do are unilateral exercises. I'm not sure why I wrote there, because I definitely meant to write farmer carries. So when you just hold a weight like this on one side, that's working your core to make sure you're not bending over either way. Rip trainer, like we have here, is an excellent way because it loads you unilaterally. You really have to work your core in order not to spin with the rip trainer. And then you can add other balance components to your training. Decrease your base of support, so stand with your feet together, feet in tandem, or stand on an unstable surface like an Eric's bed or a post. When you're doing that, though, remember, there are lots of components to muscle activity. There's power, there's strength, there's endurance, there's neuromuscular control. If you're standing on a BOSU, something people love, you're only training control. You're not training your power, your strength, maybe your endurance if you stand on there long enough. So don't think that by standing on a BOSU for an hour, you're going to be a faster runner. Okay? All you've done is learn to activate your muscles to stabilize on a BOSU. If you want to get faster, you got to work on the things that are going to make you faster. And then, just to remind you, the core is all of the lumbopelvic muscles. It's not the power generator, it's the stabilizer. You're going to want to train the power and the strength at your hips to use the core to send that power, and then it's controlling the motion. And please don't be this guy. There is no point in lifting 200 pounds on a physio ball. When you're doing balance, you're doing balance. You should be trying to get stronger. Any questions? Okay. And these are references if you're interested in looking up any of those studies.
So are you saying that you shouldn't do crunches at all? Because every class you go to, they really
Crunches aren't the end of the world, but I wouldn't do a sit-up. It's not really a useful motion. And it's, like I said, it's putting unnecessary strain on your back. If your entire goal is to have a six-pack, it's a great one, but it's not getting your whole core.
What's anti-motion?
Huh?
Anti-motion.
Anti-motion. It's just preventing motion. That's the point of the core, is to prevent motion through the back. Oh, anti. Oh, gosh. Oh, now I'm sad. Typos. Yes?
You didn't mention yoga poses. How good are yoga poses?
Depends on the pose. I am not a yoga expert, so I can't speak on all of them. But generally, you have to use it well. There's also, though, whether you're flexible or not for yoga, and not all poses are meant for you. So working with the right instructor is important whenever you're doing any exercise. Love it, but same thing, work with a good instructor. She's just asking about Pilates. So anytime you're doing a group fitness class, make sure you're working with a good instructor who's paying attention to you and how you're moving, because otherwise you're not going to get the best benefit out of it, and you might do something wrong and hurt yourself. So make sure you pay attention to who's telling you what to do. So the question was, is walking for an hour beneficial? Yeah, you're using your core when you're walking. One, it's good for just overall health. Walking is tied to lots of health benefits. But yes, in order to stay upright, your core is working. So it's an endurance activity for your core.
How about stair stepping?
I'm sorry.
How about stair stepping?
Oh, stair stepping? For the core or in general? For the core. So if you're paying attention to your hips and making sure that you're not just hiking your hip up to get it up the stair, it's a great exercise. If all you're doing is going like this up and down the stairs, you might want to rethink it. But yeah, anything that you're doing that you're keeping your hips and your trunk controlled, you're working your core. I love planks. I did think about doing a plank for the full 30 minutes, just to make it more interesting, but then I realized I probably can do one for 5 minutes. Joe did volunteer, though, if anyone wants to see that. Okay. A 30-minute plank. Well, thank you very much. And oh, yes. Yes.
If you are, when you're doing a plank,
Yeah.
if you have any kind of a weak wrist,
Yeah.
is it okay just to sort of do it at this?
The elbow plank?
Yeah.
Yeah, elbow plank's great.
So the elbow is the pressure point. I mean,
Well, it should be spread out nicely,
Spread
and then
out,
also
right.
put something soft under it.
yeah.
Just be nice to yourself.
What is a plank?
What's a plank? Joe! Joe really did volunteer to demo anything. So Joe, I have a picture of one. I could be nicer.
Could be just watch
We
the
have a
cord.
side plank here, but Joe is happy to show you a plank, I promise.
Go up front.
in a tie.
He also has fancy shoes on. He's been wearing them all day. Let's keep your clothes clean. He's going to do a hand plank so his shirt doesn't get dirty. Oh, it's not on there, sorry. No, a plank. Just a flat board. Yeah. So when you're doing a plank, important things to notice. Joe, can you demonstrate hips up in the air? Don't do that. You're not doing a pike. Hips down. Now let them sag too much. If they're sagging too much, you're going to be putting too much stress on your back. You're not going to get a good plank position. So you want a pretty neutral spine. So however your spine is when you're standing or sitting, that's what it should be in the plank. You don't want your hips up or down. And right now, he's working pretty much every muscle in his lumbo-pelvic region in order to support himself.
29
You'd also
and a
do
half
this on your hands, on your elbows, and if I was really mean, I'd make him start lifting up his arms. All right? That answers the question about what a plank is? All right.
If he lifted up his arms, he'd have to go to the sock.
It's a little harder in that position. So you can do like a side plank where you actually lift your arm and twist your body. But it's also possible to lift straight in front with normal movement through your body. There's going to be that weight shift to get your center of gravity over your base of support, but that should be it. You shouldn't have any major movements. It's a good shoulder workout. All right, I think that was it, so now you can really eat.